Hi, Orlando. I definitely will smile. Getting that pinned comment ready. Hello, hello. Hi, everyone tuning in. Just gonna wait for Marshun to jump on here. We're talking about MSM health concerns today. So just give us a second to get the comment pinned, get Marshun on, and then we'll get going. Right. I think we got Marshun coming on here now. Why, hello.
Hey, JJ.
How's it going? How are you?
Pretty well.
I love this little beret look we got going on today.
Thank you. How are you?
Doing okay. As well as can be, you know.
Mm-hmm.
I like how every time we do a live together, we get a new fashion statement from you. Is it eyeliner? Is it a beret today? It's an exciting time.
I had to switch it up because, my fave got her second #1 yesterday.
Oh, yes. Oh,
So,
we need to have a moment to talk about that for sure. Two in a
please,
year.
We need a separate live.
We can do it.
Definitely.
For sure. So yeah, I guess we'll just give people a chance to tune in, and then we'll get going since we got a lot of stuff to talk about today.
We're really gonna get into some things today.
Yes, we are. Because June Men's Health Month. Who knew? Now everyone knows.
I didn't even know.
I didn't. Now I know. Now everyone knows.
Okay.
So, yeah, my hair is getting so long, Marshun. Like, I just need a haircut so badly.
So full.
It's so
It's so full.
It's not it. Catch me like 10 minutes before going on live, being like, "What am I gonna do with my hair?" I should have just put a hat on like you did.
That's always what I go to.
There you go.
Literally.
Truly. I feel like I have the lighting figured out finally too. So
it's hidden.
We're looking good because I'm in the basement of my house right now. So gotta do it the best I can with the lighting.
Okay. Yeah.
Yeah. All right. What time is it? Is it like
12:04?
12:04. I think we can probably get started. What do you think?
Yeah, we can. Let's just dive right on.
I think it's going to be a long one, so let's just dive in.
Okay, cool.
So I pinned the comment down below for anyone who's watching to call us at that number to get connected to any of the resources we're going to be talking about today. But before we dive into everything, we definitely want to introduce ourselves first. So hello, thanks for tuning in. My name is JJ. My pronouns are he, him, his. And I am the social media outreach coordinator here at Whitman-Walker Health and part of our community health outreach team. Marshun, want to go for it?
And hi, everyone. It's the Whitman-Walker Live OG, Marshun.
True.
Or Mar for short. My preferred pronouns are he, she, and queen. And I work here at Whitman-Walker as a community outreach specialist. And I first want to thank everyone for joining us today and tuning in. And like normal, of course, we're going to really get into some things today. But first, today's topic is, drum roll, please, MSM health concerns.
Woo.
Yay!
Men's Health Month, let's do it.
We love health concerns. But before we dive into health concerns, JJ, do you mind telling us what exactly is the MSM? Because I know people get confused with M&Ms and MSM. I know they sound similar, but
they sound similar. They have some similarities. I don't know. But I'll give a brief explanation of what MSM are. So MSM stands for men who have sex with men. So you might be wondering, like, why do we use this term as opposed to maybe like gay men, queer men, things like that? And we use that because it includes basically like all men who have sex with men. So they could be gay, could be bisexual, pansexual, really irregardless of how you identify. It is going to encompass you if you identify as a man who then has sex with someone who also identifies as a man. So it's more of like a public health way of discussing health concerns and like health status, things like that, and has less to do with how you actually identify yourself.
Right.
So we also want to say that as we're going through these health concerns, we've got 10 health concerns we're going to be talking about. So I'm going to dive into it soon. But as we kind of go through these health concerns, we also want to make sure that we're being very clear that these health concerns aren't based on, like, they're not determined because of your sexual orientation or your sexual preference. So just because you are gay doesn't mean that you're going to, have one of these health concerns. It really has to do with your behavior, not
Right.
like who you actually are and who you identify as. So when we're going to say things like, MSM might be at higher risk for this or might be at increased risk for that, we're saying they're at higher risk because MSM are more likely to engage with that sort of behavior and not because it's who they are. We don't want to continue any stigma, anything like that either. So hopefully that's clear to everyone tuning in. And again, if you have any questions as we go, leave them in the comments. We'll be checking it out. But I think we're about ready to dive in. So
Yeah.
once we're ready to get going, do you want to start off by listing all of the 10 things we're going to be talking about today, Marshun?
Yes, I'll be glad to. So, our 10 health concerns we'll be discussing today. 1, HIV and STIs. I'm going to do hands too.
I'm going to do it too, yeah.
2, hepatitis.
Cool.
3, HPV and anal papilloma. 4, prostate cancer. 5, other cancers.
Oh,
6,
second hand.
depression and anxiety. 7, body image. 8, substance abuse. 9, alcohol and tobacco use. And 10, domestic violence.
10. We're going to 1 to 10. Let's dive in.
Yes.
So you said our first one was HIV and STIs. Marshun, do you want to talk a little bit about why HIV and STIs are a primary health concern for MSM?
Yes, of course. So MSMs have a higher risk of HIV and STIs. Some of those reasons include the prevalence of HIV among sexual partners of gay, bisexual, and other men who have sex with men, which is 40 times that of sexual partners of heterosexual men.
Wow.
Receptive anal sex is 18 times riskier for HIV acquisition than receptive vaginal sex. Gay, bisexual, and other men who have sex with men on an average have a greater number of lifetime sexual partners, as we all know.
Yeah.
And in fact, gay, bisexual, and other men who have sex with men make up more than half of the people living with HIV in the United States and experience 2/3 of all new HIV infection cases each year. Furthermore, young gay, bisexual, and other men who have sex with men ages 13 through 24 had about 72% of the estimated new infections in 2010. In 2012, they reported about 75% of the syphilis cases were among gay and bisexual men.
Mm-hmm.
Which is why, we always recommend you getting tested regularly.
Exactly.
We aren't offering testing at the moment, but if you want to contact us, we can refer you to different agencies.
Definitely.
The large number of gay, bisexual, and other men who have sex with men who have HIV and STD means that as a group, they have a higher chance of being exposed to these diseases. Too many men go around and don't necessarily know their HIV and STI statuses, which means they may not get the medical care that they actually need and are more likely to unknowingly spread the diseases to their sexual partners.
Yeah.
Which is why, like I said, we recommend you getting tested, using condoms when you are engaging in sexual activities, dental dams, things of that nature. JJ, do you mind sharing some ways that I, as an MSM, can protect myself from different STIs and from HIV?
Definitely. I'm so happy you asked, Marshawn. There are tons of different tools that we always talk about it as your own sexual health toolkit because no one toolkit really is going to work for everyone. You kind of have to pick and choose what works for you based on what your behaviors are and what you're comfortable with, right? So a few of the different tools you could use in your toolkit. Using condoms and lube is a really important one for sure if you're engaging in sex because one, lube is really important if you're going to be using a condom to make sure the condom doesn't break. And condoms are a great way to prevent against all STIs. Getting tested regularly, as Marshawn mentioned, and knowing your status is really important. Again, we are unfortunately not doing our regular routine walk-in testing right now with COVID-19. But if you call the number below in the pinned comment, we can get you connected to any other testing resources that are in the DMV area. And then another important one are PrEP or PEP. That is only for HIV, not for other STIs, but those are both medications, either daily or after you might have been exposed to HIV, that can help prevent against HIV transmission. So again, important to find what works for you, how you can build your own sexual health toolkit. If you want any help building that toolkit, we can talk with you one-on-one over the phone too, for ways that you can protect yourself.
Yes,
So,
and just as a reminder, we are accepting new PrEP clinic patients. And if you do need PEP, you can contact us and we can get you started on it.
Exactly. So for PrEP and PEP, we are still doing things with that. So definitely feel free to reach out. So Marshawn, that's number one, HIV and STIs. 9 to go. So would you like to move on with our next one?
Yes, of course. So number 2, the next one is hepatitis. MSMs are at an increased risk of getting hepatitis, which is a liver disease. There are 3 types of hepatitis. I'm sure you've pretty much heard of them, A, B, and C.
Yes.
Hepatitis A is spread through oral contact. So, for example, that's maybe, like getting ate out or fingered or using sex toys. Hepatitis B is spread via vaginal secretions, saliva, blood, and semen. Hepatitis C is spread through contact with the infected person's blood. So like when you're sharing needles for drug use. But not to scare you guys, I know I just listed 3 of them. There are vaccinations for hepatitis A and B. And so MSM should get those vaccinations and speak with their provider.
Definitely.
Because, their provider may not mention it to you, but it is something that can affect you. MSM should also practice harm reduction methods for preventing hepatitis C transmission. Like when you do share needles, maybe using a clean needle, washing your hands with soap and water before you inject the needles.
Yes.
JJ, do you mind sharing us our lucky number 3 health concern?
Lucky number 3, cannot wait. So our third one is HPV and anal papilloma, which are related to each other. So MSM are at a higher risk of getting HPV, and HPV is the human papilloma virus. So the virus can cause anal papilloma, which are anal warts, and certain anal cancers as well. So we recommend that if you are an MSM like me or Marshawn, you should be screened for anal papilloma just as recommended by your provider. This isn't something that necessarily you have to do like regularly, like you maybe would going to see what your HIV status is every 3 to 6 months. But it's a good conversation to bring up with your provider. And similar to hepatitis A and B, there is also an HPV vaccine that exists that is super important that it's recommended MSM under the age of 27 should get that HPV vaccine too. So I know I've had HPV vaccine. I think got it a few years ago. I don't really remember, but I think it's a series of vaccines, and it's good thing to bring up with your provider for sure.
Definitely.
So we're 3 down. I think we're doing good progress. And again, if you have any, I don't think we've had any questions so far, but if we do have any questions about anything that we've said, had any comments, just want to join the conversation, keep hitting those down in the comment section below.
Yes, build up your sexual health toolkit based on the type of sex you're having. Yes.
Yes.
So now I'm gonna go over our 4th health concern, which is prostate cancer. 4, no Beyonce album.
Unfortunate. We need to keep it going. We're gonna
Keep
get
it
lost. If we keep
going.
talking about Nicki Minaj and Beyonce, we gotta.
Stay focused. So each year, about 160,000 men are actually diagnosed with prostate cancer in the USA. And unfortunately, about 27,000 of those men die from the disease. Prostate cancer is actually the third leading cause of cancer death behind lung cancer, colon cancer in the United States, which means about every 16 minutes, another American man dies from prostate cancer,
Wow.
which is a little more than about 93 deaths per day, which include this year 33,330 deaths. That's enough to fill up a Rihanna concert, JJ.
A Rihanna concert. I was gonna say
Literally.
that maybe not
That's
now during
unbelievable.
COVID-19, but like that's
Yes, it's
crazy.
unbelievable. However, gay and bisexual men have no increased risk of prostate cancer as compared to straight men. Neither oral or anal sex increases the risk of prostate cancer. However, studies have shown that, gay and bisexual men are more negatively affected by the side effects of prostate cancer than straight men are.
Exactly.
The impact on intimacy for gay and bisexual men is particularly profound.
Yeah.
Like, it's literally profound. MSM should be screened for prostate cancer as generally recommended by their provider based on their personal and family medical histories. And yeah, that's it on prostate cancer.
Yeah.
JJ, what's our next MSM health concern?
Yeah, great. So before we get into that, I think when I was hearing you talk about all that, I think that when you said like, gay, bisexual men, so MSM, there might not be at increased risk of prostate cancer because men are more at risk of prostate cancer, obviously, but the side effects are more severe for MSM to straight men. I think that is what we're talking about with these health concerns, where it's about like your behavior. So it's nothing to do with like your actual sexual orientation or sexual preference. It's just because you are an MSM,
Right.
you're going to engage in a certain type of behavior, whether it be like anal sex, things like that, that are just going to put you at increased risk of maybe having worse side effects for prostate cancer. So those are the type of conversations I think it's important to have. But
Absolutely.
I'm happy you asked about our next one since it's pretty related to prostate cancer. So number five is cancers other than prostate cancer that MSM are also particularly at risk for. So those include testicular cancer and colon cancer. So again, MSM are not at greater risk compared to non-MSM men, but they can also put a particular strain on sexual pleasure. And similar to prostate cancer, we recommend that MSM are screened for testicular and colon cancer as recommended by your provider. So again, just add this to the list of things next time you're seeing your primary care provider, maybe even over telehealth right now with COVID-19. These are really good conversations that you can just bring up if you're just getting a little checkup to see maybe if that's something that that you might want to get screened for based maybe on your family history, your personal history, all those things. I see Soul said serving face and beret, Marshun. I think that's directed towards you. That's not towards me.
Thank you.
All right, Marshun. So we've got about 5 more to talk about. We're halfway.
Halfway done.
Feeling great. Next one we're going to talk about, we just wanted to put out a little warning to our audience since it involves a discussion of mental health concerns like depression and anxiety. So just so you know, that's what we're going to talk about next. Marshun, do you want to discuss why depression and anxiety are a health concern for MSM?
Yes. Well, we all know depression and anxiety are things we don't necessarily like to discuss in our community, which is why MSMs are at a higher risk of depression and anxiety.
Yeah.
These conditions are worse for individuals who are closeted or really don't have an adequate support system, just to offer that additional support you need, which is especially true for teenagers and young adults.
Yeah, totally.
MSM should definitely be screened for signs and symptoms of depression and anxiety and seek cultural, competent mental health services to prevent and treat mental health issues as needed. And those of you tuning in, if you or someone you know are struggling with depression or anxiety, feel free to reach Whitman-Walker's Behavioral Health Services. And that number isn't linked below, but the number is 202-939 7690, and that's the
Yeah,
Behavioral Health Services Department. We are
exactly.
here for you. We see you. Hashtag chosen family.
Chosen
Hashtag
family.
give us a call.
Yeah, totally. We're here for you. I think one of the beautiful things about being MSM is that you get to decide who your family is, right? That's what we
Yes.
always talk about for chosen family. So, regardless of maybe what circumstances you were raised in, we're here for you. You're going to find people who are here for you. And you are at higher risk of depression and anxiety because it can be really difficult, not being quote unquote normal.
Right.
Um, but we have services here at Whitman-Walker, that phone number that you can call if you are struggling with depression or anxiety.
Absolutely.
Yeah.
So JJ, do you mind
Yes.
moving to our next health concern, body image? And why is that a huge concern for us?
Yeah, definitely. So again, this is a similar as the mental health that we just talked about, where we're talking about body image and eating disorders now. So again, just a warning to the audience. But MSM are definitely more likely to experience problems with body image and eating disorders, such as anorexia and bulimia nervosa. So in MSM communities, we definitely see, I know I've seen it, I'm sure you've seen it, Marshun. We see
Yeah.
these like ideal body types on
The no facts,
Instagram,
no
social media.
film,
Oh, of
all of
course.
that.
Yep. All of
Ooh.
that. So you could either have these like hypermuscular, buff people, men who are in the gym all the time, and then you're seeing that on social media, and you're like, oh, I just want to, like that is the image of like what a standard should be. Or
Yeah.
also there's this like hyper slim, effeminate standard, like that twinks can totally like um live up to as well. So you're kind of caught in this like I either have to look super buff, super muscular, or I have to look like all these super slim twinks who are like, super skinny. Do they even eat anything? And then that can totally cause some issues with body image, right? So this can put pressure on MSM to either work out obsessively, always be hitting the gym, and enter some really harmful relationships with
And
food and
even
eating.
your self-esteem.
Yep, and with self-esteem. This really goes back to mental health too. Like
Right.
problems with your body image can totally play into having depression and anxiety too. Like this is all a huge problem, I think, in MSM communities right now.
Absolutely.
Um, Steroid use, nutritional supplements can also be abused a lot of the time. So it's important to really note that there is definitely not an ideal body type for any MSM, right? Um,
Absolutely.
you really should hopefully feel comfortable in your own body. I know that's a lot easier said than done.
Right.
But any MSM who are struggling with body image can certainly seek help with a primary care provider, with a mental health provider, and or with a nutritionist who can really work with you to develop healthy eating and living habits. So here at Whitman-Walker, we also have a nutrition service department who can really form a good relationship with you and kind of navigate like what is healthy eating, what is not healthy eating. And the phone number for that, I'll say it really quickly, but hopefully it should come up in the comments too, is 202 745 7000.
Yeah.
So,
And I just have one thing to say, JJ.
mm-hmm,
And for everyone listening, I know you, like you said, it's easier said than done, but you guys,
mm-hmm,
please never allow anyone's opinions of your bodies to upset you. Like
mm-hmm,
it's literally words. Love the body you're in. Love
100%.
yourself. Love the skin you're in. And that's all I have to say, because if anyone ever comes to my friends or their bodies, I'm reading them. Who
Period.
do you think you are? Anywho,
Anywho, so we've got 3 left. Marshawn, you're on to number 8. You want to talk about that?
yeah. Number 8. Let me count my hands.
I know, I'm
Number
like, I gotta do it
8.
in my hand. 8.
Okay. Number 8, our 8th health concern of the day is substance abuse. MSMs particularly abuse substances at a higher risk compared to other populations. These include, poppers,
Mm-hmm.
amphetamines, crystal meth, marijuana, ecstasy, and even cocaine. The pressure to use these substances in MSM communities can be very real and pressuring,
Yeah.
especially in relation to sex and circuit parties.
Yeah.
Use of these negative health consequences, especially when not used safely and for long periods, can have a hard toll effect on your body.
Yeah.
MSMs who are struggling with substance abuse should seek risk-based counseling and get appropriate education about these harm reductions. And you can also contact Whitman-Walker below if you have any questions or know someone who's experiencing issues with substance abuse. And JJ, I feel like we're almost done now.
We're really doing good work.
Second to last MSM health concern on the list.
Yeah, so our penultimate, is that the word for second to last? I don't know. I'm using my vocab words today.
Yeah, I don't know.
Sure. Is alcohol and tobacco use. So this is similar to substance use, but MSM also have higher rates of both alcohol and tobacco use and dependence. So enjoying alcohol moderation, definitely okay, but there definitely can be problems that arise from that if you then start to delve into binge drinking and other alcohol-related disorders, and abusing alcohol and tobacco. So that's also like this kind of also ties into MSM being at a higher risk of becoming victims of certain hate crimes too, unfortunately. And so like abusing alcohol can also increase that even more, especially when you're alone, possibly like say you go out to the bar, which is not happening right now, obviously, but say, you're out in a bar, you're having, an issue with alcohol, maybe you're feeling pressure from the people you're with to drink more, to smoke more, whatever. And then you end up, not being in the right headspace, and therefore you could be at risk of, being left alone. And we all know as, again, not being normal in society, that could put you at further risk of some bad things happening. So that's important to be aware of. Long-term tobacco use from smoking, e-cigarettes, vaping can lead to a lot of other health problems like heart disease, high blood pressure, lung disease, lung cancers. And when we talk about all these different alcohol, tobacco, substance abuses, we really want to preach harm reduction. So it's really important that individuals can find kind of like what level of alcohol and tobacco use work for them, but also maintain healthy relationships and healthy habits with alcohol and tobacco. We're not sitting here being like, no one should ever drink again, no one should ever smoke again. Like that's not what we're saying, because it's not realistic. We're saying find a healthy relationship with those things, and that's what harm reduction really means. So MSM who, however, are experiencing alcohol or tobacco dependence or abuse should definitely seek help with their providers, with cessation programs. And again, we are more than happy to link anyone who's struggling with that to different resources by calling the number in the pinned comment as well. And then we have one last health concern. We've made it to number 10 now. And that would be domestic violence. So Marshun's going to discuss that, why MSM might be at risk of that too. Again, this can be a triggering topic, so we just want to let you all know that that's what we're going to talk about next.
Right. Thanks for that, JJ.
Yeah.
As we know, MSMs are more likely to stay silent about domestic violence due to fear, discrimination, fear of, being looked at differently, or things of that nature. And also a lack of designated resources to accommodate them with their fears. If you don't want to disclose your sexual preference, you also may be more likely to seek help after assault, which is also another health concern and struggle that MSMs do face. Staying in an abusive relationship might leave you feeling depressed, anxious, or even hopeless. But the only way to break the cycle is to take action. And I know that's easier said than done, but MSMs are targets of domestic violence and should always notify someone about the abuse, whether it be a friend, a loved one, a healthcare provider, or a close contact. You can also even consider calling maybe like the domestic violence hotline and creating a plan to leave your abuser. And we also have resources below, and feel free to contact us if you need help finding different resources. Or a domestic relationship with someone or someone you may know. And JJ, that pretty much PEP exposure.
Same thing. Yep, same thing. See, that's proof that if you call the number, people will
It
pick up
works.
and we will talk to you. We
We
promise.
will definitely.
Yeah, we made it to 10. Look at
Yeah.
that. Look
So,
at us.
JJ, do you mind like wrapping up and relisting the 10 health concerns?
I can. Yes. Can you count with me? Can we do that again?
Yeah, definitely.
Our daily counting to 10 practice. All right. Number 1, HIV and STIs. 2 is hepatitis. 3, HPV and anal papilloma. 4, prostate cancer. 5, other cancers, especially colon and testicular cancer. 6, depression and anxiety, so mental health concerns. 7 is body image, that also ties in with those mental health concerns. 8, substance use, things like poppers, cocaine, those types of drugs, marijuana, exactly. 9, alcohol and tobacco use, and then 10, domestic violence. So we did just go through like a lot of reasons why MSM might be at higher risk for these certain health concerns, and then also kind of what to do if you think you are at risk. I think big takeaways are definitely if you feel comfortable speaking with your provider, if you are concerned about any of these, just being really informed about why you might be at risk, not again because you are gay, because you are bisexual, any of those things, but because of the behavior you might engage in. So again, like form that sexual health toolkit, learn about what works for you with harm reduction. And we're here for you. Again, call the number below and we're really happy to discuss any of these concerns with you. And before we wrap up
Yes.
here, we need to definitely remind everyone of COVID-19, still a pandemic, no matter how it might not seem that this is still happening, but it's very real. It is still out there. So again, we want to remind everyone to wash their hands frequently with soap and water, 20 seconds there. Wearing masks whenever you leave your home. Again, those masks aren't necessarily to give you protection. They do give you some protection, but it's more so to protect everyone else. So if everyone's wearing their masks, then we're all going to be more protected. And then finally, practicing physical distancing. When possible, when you are leaving your home, when you're going grocery shopping, maybe you're going to the park to go for a walk, still practice physical distancing. And then we're seeing also new orders constantly from the mayor's office in DC, from Maryland, from Virginia. So just keep an eye on how to be safe when these reopenings are happening. So that's our best advice there with COVID-19.
Right, and we are offering COVID-19 testing.
We are.
At both of our locations, and you can actually just call the number below too to get linked to your COVID test.
Totally. I know I personally went to like a few protests like recently, and I know if you're going to protest too, it's important to get COVID-19 tested so we're not spreading COVID-19 at these protests, which are, equally as important to show up for. Right. Black Lives Matter, all those things. So if you're going to do that, it's important to get tested. Whitman-Walker also offers that.
Yes.
Yeah.
And to get connected to any of the information we discussed today, like we said, feel free to call the number below, 202-797-4439 to speak with a member of our community health team. Once again, I want to thank everyone for tuning in today.
Yeah.
Thanks, JJ, for joining us.
Thank you, Marshun.
I hope you guys have a wonderful Tuesday. Be sure to wash your hands for 20 seconds and stay safe.
Yes.
And I am signing off.
Wow. Love that. All right. See you, Marshun. So good to see
Bye,
you.
JJ. Miss
Bye.
you.
Bye. Miss you too.
Bye.